Hello, this is Dr. David Greene, CEO of the Mid-Atlantic Pain Network. Today's topic is the top 10 things you should know about stem cell procedures. Stem cell procedures for musculoskeletal conditions are now reality and they are now mainstream. And this includes anywhere from professional athletes to weekend warriors and elite amateurs to all the professional sports leagues, even grandparents, senior citizens, you name it. People are more and more becoming candidates and receiving it. 10 things to know. The first one is that modern stem cell procedures do not have ethical issues. There's no fetal tissue involved. Only adult stem cells are amniotic derived from consenting donors after a scheduled C-section. So none of those involve the fetal tissue or the embryonic stem cells. Second thing is that they're showing promise for all types of wounds and arthritis, degenerative and rheumatoid arthritis, SI joint, spinal joints and discs, tendonitis of Achilles, knee, rotator cuff, elbow, plantar fasciitis, ligament injuries, labral tears, sports injuries, diabetic wounds, and even stress fractures. Stem cells, the third thing to know is that stem cells are like a blank slate. They start from really an undifferentiated state and they convert into any number of necessary cells. A lot of it depends on what environment they are placed into, but they can turn into skin cells, cartilage cells, tendon, ligament, muscle, and more. So it really depends on what situation they're placed into. Fourth thing to know is that they can actually heal an injury. Traditional treatments with cortisone act as a proverbial band-aid. They don't really heal anything, they just provide excellent pain relief. But regenerative medicine stem cell treatments offer the potential to heal damaged soft tissues, cartilage, bone. This is truly cutting edge and helps athletes get back on the field faster, helps people delay or avoid the need for surgery. It really has been revolutionary. Fifth thing to know is just to harp on this, current treatments do not use embryonic stem cells. The use of adult stem cells in research and therapy is less controversial than embryonic stem cells because their production does not require the destruction of an embryo. When you look at amniotic fluid stem cells, which is becoming also very popular, those are intermediate between an embryonic stem cell and an adult stem cell. So they have a lot of potential to develop into the different cell types, but they are not pluripotent such as embryonic stem cells. Sixth thing to know is that there are really 4 different types of regenerative medicine procedures being used now mainstream. The first is bone marrow derived. It involves an aspiration of bone marrow from a person's hip area from the iliac crest. And then at the same setting, the bone marrow is then spun around in a centrifuge with a kit, and then what you end up with is concentrated stem cells, platelets, growth factors, all that, and that gets injected into the problem area. Fat derived is the same type of process, but it uses one's own fat tissue. Amniotic derived uses amniotic fluid processed at an FDA-regulated lab, cryogenically frozen, and then thawed out at the time of the procedure. And then PRP therapy is not a stem cell therapy in and of itself, but it does call in the body's stem cells to help with repair and regeneration. Seventh thing is a little more information on amniotic-derived stem cells. They have several amazing qualities. They're obtained from consenting donors after a scheduled C-section, so no ethical issues. They are then processed at an FDA-regulated lab, and they have the following qualities: a high concentration of stem cells, hyaluronic acid, which is in our joints anyway, a lot of growth factors and proteins, and then antimicrobial properties as well. So it's a very low incidence of infection and a very high incidence of satisfaction. It's been used tens of thousands of times in the US and hundreds of thousands of times in Europe without adverse events. 8 is that there are small studies to date showing excellent results for quite a few diagnoses: knee arthritis, elbow epicondylitis, such as golfers or tennis elbow, degenerative disc disease, plantar fasciitis, ligament injuries, rotator cuff injuries, along with Achilles tendonitis, tears, and also hard to heal wounds are showing amazing benefit with stem cell therapy. Ninth thing to know is it's not yet covered by insurance. It usually takes insurance companies several years to catch up with new technology and start covering it. The cost of the procedures is going to range, but if surgery can be avoided, it can be well worth it. PRP procedures are anywhere from $600 to $1,500. Stem cell therapy is going to be anywhere from $2,500 to $5,000, $6,000, $7,000. These are outpatient and exceptionally low-risk procedures. PRP therapy involves a simple blood draw. Fat and bone marrow derived involve a simple harvesting from either the iliac crest or your fat. And then amniotic derived, you don't have to harvest anything from you. It comes out of a freezer and gets thawed out and injected. And there's minimal adverse event potential for any of these treatments. The top non-operative pain management in the Mid-Atlantic region is through the Mid-Atlantic Pain Network. There are many clinics in the network accepting over 50 insurances and providing over 25 treatment options with the board-certified doctors. Visit us online today at midatlanticpainnetwork.com and then call us for more information and scheduling at 855-444-6585. I'm Dr. David Greene with the Mid-Atlantic Pain Network. Your pain stops here.